Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Kasim Mustafa and this is JamiaTV. We are in Health is Wealth. This week we're talking about a very critical topic, a very serious topic. When people hear about breast cancer, they know it is a death sentence. Why? Is it treatable? What causes breast cancer? How is it diagnosed? How is it treated? Joining me today to help us understand this topic is Dr. Batul Gulam Hussein, a medical officer working with AAR Hospital here in Nairobi. So, Daktari, karibu sana. I know I've used a big brand hospital. I don't know if it's a hospital. I know it's a healthcare.
Yes.
Right? So, karibu sana.
Thank you so much, and assalamu alaikum to all our viewers. You have said it rightly. Yes, there is AAR Hospital, although I am coming from AAR Healthcare, the city center branch, which is actually just opposite Jamia Mosque.
Yes. Karibu sana.
Thank you so much.
People say breast cancer is a killer disease.
Yes.
But now, you know, we understand very well that breast cancer is abnormality in cells, right?
Yes.
So before something becomes abnormal, it must be normal.
Indeed.
So how normal should how is the normal breast look like? Maybe.
All right. So I think that's a very good question, that we start from the normal.
Yes.
Yeah. And you've said it rightly. Cancer is basically each person, our body unit starts from a cell.
Yes.
And when there is uncontrollable growth of cells, these cells are abnormal and they don't follow the normal commands. So now it starts bringing changes onto the particular organ, which then now culminates into what we call either someone has cancer, or there is a tumor, or there is a lump. Those are some of the terms which are invariably used by people out there. So yeah, definitely, I'm sure most of our viewers know how the normal breast looks like, but it's good to actually put it out there that there is usually uniformity, a slight uniformity in size. There are no abnormal color changes or shape changes. The nipple should be properly well balanced placed. Yeah. So when there are now changes on those areas, then you find that now there is an abnormality, and then now we go investigating until we arrive to a particular diagnosis.
Mashallah, very good elaboration there.
Yes.
So now we want to understand, do men also have breasts?
Of course, yes, they do, except that their breast tissue is much smaller than in women.
Okay.
And since we're talking about breast cancer, I must say that even men can get breast cancer.
Okay.
There is a 1% chance of men getting breast cancer.
All
yes.
Right. Now let's understand, what does exactly breast cancer mean to our viewers back at home?
Yes. So basically, when we are talking about breast cancer, we are looking at cancerous changes in the DNA, or rather when we have gene mutations, genetic mutations, in the DNA. There are particularly two types of mutations, BRCA1 and BRCA2. We call them BRCA1, BRCA2, so to speak, in medicine. So when there are these genetic mutations, or either someone was born and inherited that gene mutation, then now you find that there is changes in the breast which starts happening. And the most commonest change which starts is either in the milk ducts or now in the gland itself, the lobules. So we either call them ductal cancer in the milk ducts, or in the lobules, which is now the glands which produce the breast milk. It's very rare to get it in the fatty and the fibrous tissue around it, but generally those are the two main areas where breast cancer begins.
All right. Now, breast cancer begins. You've talked about the
milk ducts.
The milk ducts, yes. So I want to now understand the difference between a male breast cancer and a female breast cancer before we even move further to this topic.
Yes. So, yes, in women we have talked about the milk ducts, but remember there is also the fibrous tissue, the stroma. So now again the cancer can actually take place in those areas as well.
Yes.
Remember, both have nipples as well. So if there is any stromal issue or a ductal issue, it can happen in either or.
many believe that cancer only affects women. And as you well put it, is that also men can get breast cancer. Can we understand the causes of breast cancer in women? Then we move to what might be the causes for breast cancer in men.
So the causes of breast cancer are very many, and I think it's important that we take some time and actually categorize them. So first of all, age. Okay. And age being the fact that nowadays, before we would say only women above 50, 60 get cancer, but now even between 40 to 49 years old, there is a moderate risk. Of course, now above 50, the risk is increased, and over 65, then the risk is much higher. Okay, but if you have family history, again, we go back to the genetic mutation. So age is a risk factor. Being female is a risk factor. Just by the virtue of the fact that you are a female, your chances of getting breast cancer significantly increase. Okay. Then we talk about the genetic mutations. Our lifestyle also plays a huge role. Things like physical inactivity, not exercising well enough, regularly. Our diet, if we are obese, the risk of breast cancer is higher. For those who take alcohol, the risk is much higher. Hormone replacement therapy. There are some women, when they go through menopause, they opt for HRT, hormone replacement therapy. Now, the prolonged exposure of use of hormones and hormonal medications, and oral contraceptives included, all right, poses as a risk of developing breast cancer. And while we are talking about hormone replacement, girls who get their periods before the age of 12. Remember, now hormone production has started. So the time between the periods, the menarche, we call it menarche, to the time of menopause, the hormone exposure time increases. And that automatically also increases your risk for getting breast cancer. So a late menopause and an early menarche. And again, why are girls getting puberty so much earlier than they used to? Lifestyle, obesity, childhood obesity, stress, psychological factors. Another very strong risk factor is how early you start your family. So women who get children after the age of 30 are at a higher risk of breast cancer. As well, if you do not breastfeed, at least up to the age of 1 year, 2 years for your children. Remember, we talk about exclusive breastfeeding up to 6 months, and then up to 2 years breastfeeding should continue. So women who now opt to stop early, or maybe for one reason or the other are not, that also increases their risk of developing breast cancer. So generally, when you look at it like that, mainly it's about hormone exposure, your lifestyle, how you live, what you eat, how active you are, how your weight is, all that plays a role. Alcohol intake, we talked about that, and generally even now this hormone exposure. Even radiation exposure poses a risk. So let's take, maybe they were born maybe in childhood with another lymphoma, and they had to get some radiation around the neck or chest. Then that increases the risk of breast cancer. But I want to state that doing a chest X-ray does not pose a risk for yes. And those women who take oral contraceptives as a method of birth control, yes, over a long period of time, that exposure, the risk is there, but when you stop, also the risk goes down. So it generally is not one of the most strongest, but yes, hormone replacement therapy in menopause is one of the strongest risk factors.
I've grasped whatever that you've said. You say the risk factors include hereditary. Someone can inherit it. And another factor is age. You talked about lifestyle habits, that is food. There are those people who use alcohol. You also talked about obesity. If you are fat, you are likely to get a breast cancer, hormonal imbalance and all that. But now what I'm very much concerned of is this 30 years and HRP. Those people who are mostly using contraceptives. Maybe you talk about these contraceptives. Then 2, you also talk about this age of giving birth. What is the best age of someone giving birth? Because 30 years, you are at higher risk of getting breast cancer. What is the best age?
Okay, so what we are saying is, if you get children after the age of 30, that poses as a risk factor. Yeah, so usually when we talk about best age, it's very debatable. Yeah, it's very debatable. Of course, a lot of factors influence that. But generally, between the age of 25 up to 35 is a good age. Even younger, sometimes the better. But of course, as I said, a lot of factors come into play with that decision. But what we are saying is women giving birth past 35, almost 40, you know, late pregnancies, that is a risk factor. And hormone replacement therapy, HRT, that one is different. That one is medications given in menopause or after menopause, trying to help with some of those symptoms of menopause and all that. So we usually try to encourage women to do it the natural way. Yes, it can be difficult, but that's a topic for another day. But try to, you know, avoid the HRT replacement, the hormone replacement therapy. Oral contraceptives, like I said earlier, is very okay to take generally, but of course comes with risks, and breast cancer is one of them. Although some statistics say that once you stop the oral contraceptives, the risk diminishes. So it's only while you are taking. And most of the time when we talk about hormone intake, we are looking at people who are taking for over 5 years. So generally, once you stop, then your risk significantly diminishes.
And what are these warning signs for someone to know that maybe I might be having some signs and symptoms of breast cancer? Of course, there are some of the warning signs. One of them being change of the skin.
Yes, indeed, you are very right.
People will think I'm talking about the skin. I'm not talking about the face skin. I'm talking about the skin around the breast. The breast. So what are some of these signs?
I think that's actually the main gist of it. How do we know? How do we know? So first thing is being keen, and if you look, usually there are about 7 signs of breast cancer, or rather breast changes. So the first thing is in the normal contour and shape. So even when you just look at yourself, you will find that maybe there is an abnormality or asymmetry. You know, usually they are symmetrical, but when you find that one looks way much bigger than the other, or there is an abnormality, then now you know there is a problem. The second thing is skin changes. There may be some redness, there may be some dimpling. In medicine, in some of the books, they describe it as a dimpling appearance. They liken it to an orange peel appearance, kind of like how the oranges look like, so that kind of texture. That is what we call dimpling appearance. Then, of course, come the nipple changes. They're not in any particular order, but you know, any can appear. Nipple changes. You find that the nipple has become inverted, or there's some changes around there which was not there before. Nipple discharge. Remember, if you're not pregnant, or rather if you're not breastfeeding, there should be no discharge from the breasts. And this discharge, we're talking about either a clear fluid coming out or a bloody discharge. That ideally should not be there. Other than that, of course, the most classical, which what your opening statement was, that it's a lump. So does a lump mean it is cancer? So a lump generally straight off immediately does not mean it is cancer. Of course, a lump is a lump until it is diagnosed and confirmed. But lump, yes, is a sign of breast cancer. Even lymph node enlargement. So sometimes you may find some swelling near the collarbone or in the armpits, which are where our lymph nodes are located. We call them axillary lymph nodes. So if those are enlarged, or you feel like a thickening around that area or a tightening, then that can be indicative of that. There's also another symptom of pain and tenderness, but usually there's some tenderness experienced around the time of your periods for a woman. And if this kind of tenderness or pain persists for over a month, meaning even after your cycle is finished, you're still feeling that consistent feeling, then it needs to be checked out.
Yeah.
What I would like our viewers to know at least is that it is the painless lump which is most worrisome. And that does not hold true, like I said, until you make a diagnosis and confirm is when you can say there is a problem.
This is a problem.
Yes.
Okay. You talked about the pain, and it's actually one of the questions that I wanted to ask you. I wanted to say, can pain, I think it's here, can pain determine that someone is having breast cancer, and at what time can someone prompt to see a doctor? But you've already highlighted it.
Yeah.
So another question that I'm interested to know is now, how important is early detection? How important is it?
So that is the $1 million question, how important it is. Yeah, it is extremely important. I cannot stress enough upon how important early detection is. So several reasons. Early detection means greater chances.
Yeah.
It also means treatment outcomes are better.
Yeah.
Yeah. It improves your chances of survival. There is usually what we call in cancer the 5-year survival rate.
Yes.
Yeah. So the earlier it is detected, then your 5-year chances of survival increase. Yeah. So generally, if we just talk about why detect early, save yourself some trouble.
Okay.
Yeah. So detect it early, screen for these things early.
Okay.
The sooner you screen, the sooner you get to know, the sooner you get to the doctor. Yeah.
Now you talked about you talked about screening. Maybe you talk about self-examination. Can men do self-examination? That is one. And two, how can we do this self-examination, both men and women?
Okay. So self-examination, self-breast examination is a skill everyone and anyone can do it. Yeah. There are two main aspects to it for both men and women. It's actually just the same. So I'll just talk about it together.
Yes.
Generally, it is look and feel.
Okay.
So we talked about the signs and symptoms. So generally, you're looking out for any abnormality in the shape.
Yes.
You're looking out for any asymmetry. You're looking out for any skin changes, dimpling, the nipple, discharge, and then now feeling.
Yes.
Feeling is basically using your fingers.
Yes.
This is the most sensitive part of your hand, and just going around systematically all through the 4 quarters of the breast. We call them the quadrants, and palpating generally to feel out for any kind of lumps.
Yes.
Yeah. Now, in how it should be done, it can be done while you're in the shower. It can be done while you are sleeping.
Yeah.
It can be done while you are sitting. Yeah, but the main aspect is make sure the breast tissue is free. So raise one hand behind your head and then use the opposite hand to examine that side of the breast, the opposite side of the breast.
Okay.
So the breast tissue should be free.
Okay.
So if you're lying down, if you're sitting, the hand should be behind your head so that you use this to examine this side of the breast. Ideally, this kind of examination should be done once a month. Once a month is important.
Okay.
And if you have family history, however, as much you can do, of course, within control, once a month is okay.
Okay.
Yeah.
You talked about screening.
Yes.
Are there any other methods of screening? Maybe I cannot ask that way. Maybe I say, what are these types of what are these methods of screening?
Yeah.
Yes.
So in fact, it's one of the best questions because once someone is at home and they've felt something, the next thing is now what?
Yes.
Yeah. So some of the screening methods include breast ultrasound.
Yeah.
Classically, they usually say below the age of 35, we tend to go for ultrasound. Above 35, we go for mammogram. Okay. So for mammogram, you can get it done at any of the clinics. Most hospitals have mammogram, ultrasound. Some of the deeper methods include now breast MRI. So you can get an MRI done. And of course, there's also contrast mammography. Which now actually even looks at the blood flow and any abnormality in that. But the gold standard eventually is a biopsy.
Okay.
So biopsy simply means it could be a fine needle aspiration, or it could actually be removing the lump and examining it under a microscope, and then now ascertaining. So that one is now the final, what we say, the msema kweli. Yes, is it cancer or what is it? Yes.
There are different types of biopsy.
There are different stages of cancers and types of cancers, but biopsy generally, it can be a core biopsy, it can be a fine needle aspiration, where they're just removing a little bit of the fluid from there, or they might even just do a full lumpectomy, and then the lab will decide how, or the pathologist who now does the sectioning and the slides, will now decide how to diagnose and come up with the diagnosis.
Okay, I know our viewers back at home are having very many questions, because when you talked about risk factors, of course we have modifiable and unmodifiable. Someone is having a lot of questions. How do you know? Because modifiable risk factors, these are factors that can help you can escape from them.
Yes.
Right?
Yes.
But non-modifiable, once you get them, you are at higher risk.
Yes.
So maybe we try and explain to them, and so that they understand exactly what are these non-modifiable risk factors and modifiable risk factors. Then I think because time is really not on our side, we see the other topic to discuss.
All right. So when we're looking at the non-modifiable, that one is simple, things you cannot change.
Yes.
You cannot change your age, you cannot change being a female, you cannot change inheriting a gene mutation or developing a complex genetic mutation. So those are things you can't change. But things you can change is, number one, developing an active lifestyle and a healthy lifestyle.
Yes.
So we are looking at diet, we are looking at weight management, we are looking at exercise, very important. Secondly, we are now then looking at things like alcohol intake. Remember we said taking alcohol is a risk factor. Use of hormone replacement therapy, you can avoid it. Making sure we breastfeed our children all the way to the age of 2, and avoid stopping prematurely. Of course, benefits to both baby and mother now. And use of basically hormone replacement therapy. The sooner we can avoid, the better.
Wow. Now the question that I'm having, and it's indeed one of the questions that very many people, men especially, are asking themselves, is that men, you did mention that men have breast tissues.
Yes.
But now I want to understand, you even mentioned the risk factors for them. But what might lead to them being disposed to breast cancer?
Family history, most of the time, family history and genetic mutations. So in men, the risk factors are much more limited. Again, lifestyle. Lifestyle again plays a role. Of course, in men, you will not find the other risk factors having a bigger role to play as such.
All right. Time is really not on our side. I'll still request you help us understand this topic in another episode for the next week, inshallah. So, ladies and gentlemen, really time is not on our side. But now, before I end this topic, because we have a lot to discuss, we haven't talked about diagnosis, we haven't talked about treatment, we haven't talked about what you need to do, you as a patient back home. But before I end it here, of course, I have to give the Daktari a chance to send his message clearly to you back at home. Daktari, what is your parting shot?
I think for me, the parting shot when it comes to breast cancer is number one, early detection. A good lifestyle. When you detect a lump, please don't fear. Fear is the last thing. Of course, it's inevitable and you cannot control it. But follow the right channels. Get to a doctor. Don't delay treatment. So early detection, screening regularly, do your annual checkups, make sure breast examination or a breast ultrasound is part of it. And I think that would lead to much better outcomes.
Mashallah. Thank you so much. Early detection, early screening, and In case you hear or you feel an abnormality in your breast, whether a man or a woman, please visit a doctor. Until next time, my name is Kasim Mustafa. Masalam.